Hey guys, Dr. Brooks here with spine+sport again. We're going to continue with the theme of the low back pain, but what I want to talk today about is basically proper abdominal stability to get your pelvis in a good position. So up till now we've talked a lot about how when the T-spine doesn't move appropriately, when the hips don't move appropriately, the lumbar spine ends up moving. So we spent a lot of time talking about getting those pieces of the body to move appropriately. Now what I want you to think about is, now that we're moving appropriately, we need to keep the lumbar spine in a good place. And that has to do with our abdomen activation. So we're going to go over a really basic, a really elementary protocol known as a pelvic tilt or a lumbar smash. So for this movement, what a person does is make your way to a position where you're flat on the ground here. Your feet will be up, I don't know, let's say about 6 to 8 inches away from your butt. In this position here, I'm in a neutral spine, so I can fit my hand underneath the small of my back. What I'm going to do then is think about activating my abdomen. So what I want you to visualize here is if I drew a line across the bottom of my rib cage and I drew a line across my belly button, I want to activate my abdomen to decrease that space. Okay, so in a neutral spine position, that space is, we'll say 6 inches apart, okay, 6 inches. When I'm activated, I decrease that down to 5 inches. What that will do is it'll smash my low back into the ground, activating my abdomen, getting my lumbar spine in a good position, and getting my pelvis into that correct position, okay? So neutral to smash is what we're doing. So it's not a aggressive movement, okay? It's really, really subtle, where we're going from neutral position where I can fit my hand underneath my low back. I don't want you to think about arching the low back and hyperextending, but just come neutral where you can fit your hand underneath your back, activate that abdomen down to smash the low back into the ground, and rotate that pelvis posterior, okay? Posterior pelvic tilts.